I'm joined by family physician Dr. Perle Feldman to talk about Quebec's recently announced plan to reform the healthcare system, which focuses on access to family doctors, decentralized management, and 48 more measures. Thank you so much for joining us, Dr. Feldman.
Thank you, Alysia.
How do you feel about the government's approach?
Many of the suggestions are excellent, but the devil is in the details. It's how they will be applied that will make the difference. Saying they're going to uphold family medicine is a lovely sentiment, but how that actually is in real life, we don't yet know. The devil is always in the details. New clerks, great idea. End to harassing and destroying nurses' lives, wonderful idea. More multidisciplinary care, great idea if done in the right way.
There are almost 1 million Quebecers who don't have a family doctor. What do you think about the shift from paying family doctors per act to now paying them for the amount of patients that they take on?
So you have to be very, very careful. This type of thing is called capitation. It's been tried in other places. The problem with capitation is unless you properly incentivize doctors to take on more vulnerable patients and to acknowledge people with complex medical issues, there will be some of my colleagues who will do what we call cherry picking. They will sign up only low-risk patients who have few medical conditions, and they will get paid a lot of money for seeing healthy people twice a year. Whereas patients with diabetes, hypertension, mental illness, who have psychosocial great difficulties will have more trouble finding a doctor willing to take them. Capitation is okay if it's done correctly, and doing it correctly is not easy.
What do you think about the government's plan to set up a phone line by the end of the summer for a one-stop service where a nurse would direct patients to the appropriate medical service?
If the appropriate medical services do not exist, how is a phone line going to help you to find them? I mean, it's lovely if people can be directed, but I don't know any family doctors in Montreal who are crying to have new patients. We are all overstressed, overloaded, and there are fewer family doctors in Montreal per capita than in most places in the world, and even in Quebec.
Thank you so much for joining us, Dr. Feldman.
Thank you.